We'll wait for 1 more minute. So before we start the plan of action of oral surgery. How many have passion towards oral surgery? Passion or interest or something like you have that passion towards oral surgery. Like simple question. How many want to become oral surgeons? Maxillofacial surgery. How many of you want to pick maxillofacial surgery as an option in your counseling? Yes, I can see decent number of people responding. Okay, all of you, do you want to end up just as an oral surgeon, or you want to explore the oral surgery? Like for example, you have so many fellowships that are available in oral surgery. Yes, you have oncology, you have trauma, you have craniofacial, you have cleft lip, cleft palate. You have so many things, so many fellowships, and probably in the upcoming few years there will be further more fellowships. Yes, facial reconstruction, facial aesthetics, so many things are there. Okay, so what my suggestion for all of you is, for example, if you want to become an oral surgeon, don't keep your limitations only for MDS oral surgery. MDS oral surgery is just a part of your journey. It's not the entire journey. And if you do MDS oral surgery, you can maximum can handle a case of impaction or an extraction or a simple maybe a simple trauma case you can handle. But that is the reason why exploring oral surgery is more important rather than picking an oral surgery as an option in MDS. Okay, so people who has a thought to become an oral surgeons, okay, the future requires a fellowship. Okay, the future requires a fellowship means you have to select. I mean, don't decide that you have to do fellowship in this particular wing or in this particular branch now itself, because oral surgery MDS is a 3 years course where you will know which part of oral surgery and which department of oral surgery, the sub departments of oral surgery you are more interested to, or which department, which part of oral surgery has more demand. So basing upon the demand or basing upon the requirement at that particular situation, you decide which branch you are going to pick. But as of now, don't keep anything in your mind, okay? Because your knowledge is just, as I discussed, your knowledge is just 10% around the globe of the dental field. Only 10% is, you know only 10% of dentistry now. Okay, so don't decide anything. Whatever department you want, you can choose now with your knowledge, or throughout the preparation, or you have some one and a half year of time to get into MDS, because MDS counseling for you will be like 1 year 4 months or 1 year 5 months from now. So you have this time to decide which branch you want to go. But if you want to become an oral surgeon, the point is the particular field, the particular fellowship has to be decided during the process of oral surgery MDS. Is it clear, guys? Don't decide like what field you want to go ahead now itself, because 3 to 4 years of time everything around you will change. So you need to pick something which is interesting for you. Second, something which is demanded, something which has more demand at that time. So you should see what market wants at that particular time, and accordingly you have to plan. Is it clear? I hope it's clear. Like most of them has this norms. Okay, day one only you decide you want to become something. No, it's not possible. It's something like an upgradation. Like for example, you see every 3 or 4 months you'll get an update regarding a particular app, right? Why they want to get upgrade? Similarly, the professional life also will get upgraded at different levels. Level 1, okay, this is what. Level 2, this is what. So during the process of MDS, you learn so many things, so many new things. Whatever the 10% knowledge you have in dentistry, that will be drifted to a higher number during the process of MDS. And during that period, you can take some good calls like this, choosing the branch or something, which is very, very important and which is very, very keen. Right? Okay. Shall I jump into the main content of today's session? I'll try to wrap up it within half an hour. Okay, right. So the department you have in front of you is oral surgery, as already said. Okay, now we are going to handle, in the upcoming days, we are going to handle one module called as surgical module. Surgical module we are going to handle in the upcoming days. Okay, so what are included in the surgical module which I have discussed? One is oral surgery. Second one is general anatomy. General anatomy will include general histology and general embryology also. Okay, so be clear, general embryology and general histology are included in general anatomy. Histology and embryology are not very specific stuff related to this. Just a second. Right, and the next one is general surgery. Right, is it clear, guys? Surgical module. So the upcoming 40 days, 45 days, you are going to focus on the surgical module: oral surgery, general anatomy, general histology, general embryology, and general surgery. Okay, so according to NEET blueprint, this module is going to carry 14 marks of general surgery, 14 marks of anatomy plus embryology plus histology, and 14 marks of oral surgery. So totally it's going to carry 42 marks. Okay, out of 260, 240 marks. Okay, 40 marks is 1/6. So it's going to carry 1/6 of the marks in your examination. Is it clear? Are you clear about the number of marks or number of MCQ, number of questions that you can predict around this module is this area? And trust me, of course, now we read both from the memory based point of view as well as the concept based point of view, but final exam, most of the things will move around the concepts. Okay, so don't break your heads. You're going to you need to hit somewhere around minimum 35 plus right answers in this area. Okay, but here we try to teach both conceptual as well as memory based things, so it's going to be tricky for you, but final exam will move around, mostly will move around conceptual things, and it is mandatory that you need to hit somewhere around 35 plus score, okay, in this particular 42 marks. Okay, done. Can I move? So this particular video will be focusing more on oral surgery, and once we start general anatomy, I'll be discussing about the general anatomy. We'll take a live session like this. So how many marks I told you? How many marks oral surgery exclusively in your NEET exam? How many marks? 14 marks, right? Perfectly right. And the one more exam you have, INICET. And INICET also carries very huge number, somewhere around it will go around, INICET will go around 12 to 15 marks around this particular subject. Okay, so this figure varies from year to year, but this is always constant. Is it clear? Clear about NEET number of questions from oral surgery? Clear about INICET number of questions from oral surgery, right? So next important things to be like important things, what should be the most important key thing about this is just recapping the things what you have done previously. Okay, so for example, in a oral surgery department, I don't bother like whether you're a good student in a final year or in a UG level, or now you may be working in a clinical scenario, but my question for all of you is, what you have done in the clinics of oral surgery? What you have done, what you have seen, just tell me what you have done, what you have seen in the clinics of oral. First one, yes, of course, Priya, you're right, you have done so many extractions. Okay, apart from extractions, have you done anything? Yes, of course, blocks, extractions plus blocks. Intermaxillary fixation. Anything more? Suturing techniques. Suturing, intermaxillary fixations. Have you seen any cases, tumor cases, cyst cases? Have you seen any cases? oral surgery, oral medicine. Okay, cases are important because case-based questions you can predict. A combination of oral medicine and oral surgery. Okay, right. That knowledge is required. For example, you have a fracture case, orbital fracture case is there in front of you. So you should be in a position to tell what are the clinical features you see in this particular case. Okay, that's a good aspect. Like if you're being exposed to such cases, if you have seen such cases, it is easy to remember the things. Okay, there is nothing very extraordinary. It's going to be easy for you to remember the things. I mean, like you can recollect the things. You can easily read the things. That is an advantage for you. Okay, that's an extra advantage for you. If not, you have to see and learn. Okay, so my suggestion for all of you, please, my suggestion for all of you is kindly correlate everything, whatever you're going to read, with a diagram. Is it clear? Is it clear? I mean, most of you, I mean, for basic reading or for basic MCQ books, whatever you're doing is you're doing some MCQ books, and most of the MCQ books doesn't have diagrams. But what I can say is, NEET out of 240, you will have 40 diagram based questions, 40 plus. So everything has to be correlated to a diagram. Of course, in your smart video content, you will have diagrams everywhere. Okay, but what my suggestion is, even if you don't have a diagram, try to search a diagram on the Google and try to link it. Okay, so we are posting so many diagrams, but you also have to do job from your side, right? So all this, whatever you have done, will be useful. How they can be useful? To retain the subject. Like once you see a patient of mandibular fracture, you can easily remember the clinical features of mandibular fracture rather than reading. If you see it, you can easily remember. Okay, I mean, seeing a case may not be possible in every college. I agree for that. But seeing a pic on a Google, seeing a pic on a smart video, seeing a pic by your own interest is possible. Is it possible or not? Seeing searching for a diagram and learning something from diagram, imagining that as a clinical scenario, that is possible. So everyone, you try to show that utmost interest so that this oral surgery is going to be one of the easiest subject. It is vast. It is vast. I agree. This is vast. But thing is, it can be easy only if you imagine the situation, only if you have a clinical grasp over a particular condition or anything. Is it fine? Can I jump into the next content? Okay, so this is how I have splitted your subject. So what I have done, I have given local anesthesia 2 days. Local anesthesia means entire local anesthesia, both the clinical. I mean, I never prepared, because what you do at a UG level is blocks. Okay, you do blocks, but what you less focus on is the chemistry of local anesthesia. So in the video content, we try to focus more on the chemistry. Okay, I just ignored the blocks, because blocks, everyone are familiar with blocks. You are familiar, every normal individual at a BDS level are familiar, because I ask you one tooth and I ask you what are the blocks that you have to give this extraction of a particular teeth. I hope most of you can handle this. If not, you have to work on this, right? Is it okay? So we have given 2 days for local anesthesia, followed by medical emergencies and their managements. Medical emergencies in dental office and their managements. Okay, you have a specific textbook for this that is called as Malmed. Local anesthesia, the reference textbook should be Malmed again. And medical emergencies, the reference textbook should be Malmed again. Malmed, medical emergencies in dental office, Malmed is a different textbook. And local anesthesia, Malmed is a different textbook. Make sure whenever you get a doubt, whenever you want to refer, you have to refer these books only, whatever I am mentioning here, not any other book. There are many books available, but most of the paper setters, they follow these standard books only. So to leave that controversy, I want you to stick on to this particular book itself. Okay. So then jumping into that, I am focusing more on exodontia and impaction. I have given 2 days for you. Okay. So this is a lecture day. I was just added CPRs. So CPRs, you have new 2020 guidelines, which are being covered as a video. So this is not going to take much of your time, less time. So this day you can keep it as a revision for your backlogs. Whatever backlogs you have at this particular time, you can keep it. So temporomandibular joint, you have to cover anatomy. Anatomy is a part of general anatomy, and disorders are a part of oral surgery, oral surgery and oral medicine. Okay, maxillofacial, maxillary sinus anatomy and its disorders. Coming to that, I have given 3 days for you for maxillofacial trauma, which includes leafoids, which includes orbital fractures, which includes zygomatic fractures, which includes mandibular fractures, and their treatment plans and everything. You know how important a fractures is to your final year exam. Similarly, the fractures are important. Next comes, we have many questions on drug interactions in 2018 and 2019. So that is the reason why I have given a special day for drug interactions. Hope you remember your pharmacology, dental drug interactions. Okay. So this topic is well covered in your MALMED again, medical emergencies of MALMED. Of course, the clear-cut contents are given in your smart notes. Okay, smart notes, you have the drug interactions, all the drug interactions which are important for exam were covered in your smart notes. You can go back and check. Then orals, then orthognathic surgery, a combination of ortho plus surgery, then pre-prosthetic surgery, a combination of prostho plus surgery. Cleft lip, cleft palate is again a combination of many subjects. It comes in pedo, it comes in ortho, it comes in oral surgery also. Then comes the cysts and tumors of orofacial region. Now we'll be focusing more on surgical aspects. Okay, because the basic aspects will be covered in your oral radiology and oral medicine. Now we'll be focusing more on the surgical aspects. Then comes the facial nerve paralysis, as well as your trigeminal neurology. All these are going to come. That is called as facial neuropathies, neuropathology. This is again the oral medicine and radiology part also. It will be covered in many subjects. General medicine also it will be covered. Apart from that, we'll talk about malignancies and the treatments. That's what your oncology and everything. And recent advanced procedures and everything will be covered. Of course, damn importance has to be given for the diagram-based content, followed by revision and followed by the examination of oral surgery. I hope this division is clear, very clear. Okay. I have allocated so many days. The reason why I have allocated so many days is, apart from covering oral surgery, what I'm doing is I'm covering medical emergencies here, which is a part of general medicine. I'm covering local anesthesia, top to bottom, which is a part of pharmacology. I'm covering drug interactions, which is a part of pharmacology. And whatever you do now, you no need to do the same content when you're doing in other subjects. For example, orthognathic surgeries. Do at the best here. No need to touch orthognathic surgeries when you're handling ortho. Because if you open ortho and see, orthognathic surgeries is one topic. Similarly, pre-prosthetic surgery is a topic for you in your prostho. So if you do these things at the best, so whenever you're doing that particular subject, you can save one more day, 1 more or 2 more days. Similarly, cleft lip, cleft palate is a topic in your pedo as well as in your ortho. So now you cover now along with oral surgery, you're covering 2 topics of ortho. That is, one is orthognathic surgery, second one is cleft lip and cleft palate. Similarly, what you're doing here, you're covering temporomandibular joint anatomy, maxillary sinusitis anatomy, and space infections, means all anatomies of space infections. Thereby, you're doing 10% of your general anatomy also here. Is it clear? So this sort of doing one subject integrated with other subject is called as integrated mode of preparation. You cannot have this extra edge of integrated mode of preparation with most of the institutes, because oral surgery will be handled by a different person over there. Ortho will be handled by a different person over there. Pedo will be handled by a different person over there. And the only advantage here MDS Conquer is, most of the subjects, we as a team, we are going to handle it. The core team is going to handle it. Of course, oral surgeon will come and teach you, but the core team is going to handle you. And so the core team will know what an oral surgeon is teaching related to orthognathic aspect. So by which we will ask the orthodontist to ignore that. Is it clear? I hope you are clear with the schedule. You don't have any doubts related to the schedule. So local anesthesia 2 days, medical emergencies followed by exodontia impaction 2 days, CPR modifications you have to see, temporomandibular joint, maxillary sinus, maxillofacial trauma, drug interactions, orthognathic surgery, pre-prosthetic surgery, cleft lip, cleft palate, cyst facial neuropathies, of course, space infections, and there are many other things. Okay, many other things which I'm going to tell you what to be done, how to be done, and everything. Okay, done. Can I move? I want you to be active. I want you to be active. I want you to respond me as active as possible. Yeah, we have 180 plus strength. It's a good strength. First time we are seeing that huge strength. Okay, chillo. So next one, what I'm going to tell you is, I'm going to tell you the sequence of checklist, but if you just have a glance over, can you see the video content? So this is a video content available for you on the website. Okay. So I'm just going to give you a glance, like what to be done at which time, what to be done at which time. Zahir, everything will be covered. No need to worry. Book references, everything I'll tell. Once the session is done, you can ask me what extra things you have doubt and everything. Everything will be covered. No need. Conquer is something that everything will come in an organized way. No need to worry. No need to worry, right? Okay. So you can see the video content. So first is exodontia. I hope you're familiar. Your impactions, classifications of your impactions, your difficulty index, and all these will be covered. So local anesthesia, you have 3 parts, out of which, apart from the chemistry of local anesthesia, I tried to cover the calculations related to the local anesthesia. Hope in your oral surgery department, I hope you remember that what is the maximum dosage of LA given to a particular individual with vasoconstrictor, without vasoconstrictor. So all those things will be covered in this local anesthesia part 1, part 2, and part 3. Then I told you to focus on temporomandibular joint. Maxillary sinus, you have 4 parts of videos. Okay, cleft lip, cleft palate. Okay, all these are covered in your schedule. Whatever I'm ticking with blue color, all these are covered in the schedule. Orthognathic, you have 2 parts. Pre-prosthetics, you have 1 part. Whatever that is not covered in the schedule, I'm just marking it. Okay, clear anatomical spaces of orofacial region. This is called a space infection. Okay, hope guys you remember your space infection questions. Most commonly asked question, mandibular space infection, right? Okay, so this is not covered in the smart video schedule, but you have to allocate in the schedule accordingly, right? This is one, right? Next one. So all these dental considerations will be coming under medical emergencies. So I told you I have given 1 day for you for medical emergencies, where you need to cover dental considerations for pregnancy. Pregnancy is a medical emergency in your department. What to be done for a pregnant woman, chair position for a pregnant woman. Okay, everything. Similarly, there is something called as emergency drug kit, which comes under medical emergency. Okay. Then after, you need to focus on the medical emergencies of adrenal insufficiency, medical emergencies of bronchial asthma, COPD, medical emergencies of hepatitis, medical emergencies of hypertension, myocardial infarction, and infective endocarditis. And all these are going to come under medical emergencies. Then as of now, I want you guys to ignore this particular thing, general anesthesia part 1 and part 2. This we will be doing in general surgery. So we'll be doing in this particular surgical module only, but I'll be teaching you the general anesthesia part in your general surgery. Is it clear? Is it clear, guys? General anesthesia we'll be doing in general surgery. Don't touch general anesthesia now. So then we'll be jumping into infections of secondary spaces, which is a continuation of space infection. Space infection 1 chapter we have already done, right? So anatomical of the orofacial spaces. This is a second part of space infection. Then I told you some diagram based questions. So most of the diagram based questions are covered along with the contents. For example, mandibular fractures, you have mandibular space in mandibular diagrams and everything. So apart from that, in your for example, in your final year exam, practical, Viva, so they'll ask you instrument based questions, right? So they keep an instrument, ask you what is the use of this instrument, identify the name of this instrument. So all those diagram based questions were covered in the instruments part 1. part 2, part 3, and part 4. Okay, this is diagram based content. So then jumping into the maxillofacial trauma. So all these contents left over are maxillofacial, that is mandibular fractures, MCQs on fractures, midfacial fractures, nasal bone fractures, orbital fractures, and nasoethmoidal fractures. Your primary care in fractures. Okay, so this is a space infections again, the third part of space infections. Okay, syncope is a medical emergency. Syncope is a medical emergency, followed by treatment of oral cancer. I was talking about malignancies, the last topic. So malignancies and the treatment, of course, zygomatic fractures comes under the fractures. Is it clear about the content? Clear about the smart videos as of now present. Maybe smart videos, view of the smart videos, if required, they'll be updated in while you're preparing for this oral surgery, or when we are taking the oral surgery for the second round. This is the smart video content available as of now in oral surgery. So apart from that, there is something called as smart notes. Okay, smart notes, I'm going to tell you. Smart notes is, I told you, drug interactions from Malmed has to be covered. This is that smart notes. I told you, right? Drug interactions is completely an memory based aspect. So what I have done, I have added drug interactions, direct stuff from your Malmed, which you have to do for this. Drug interactions, this is the one PDF, this is the one notes you have to do. Then comes the instruments. Instruments are already covered in your videos. Instruments part 1, part 2, part 3, part 4. Okay, so once you're done with that, if you want, you can have a glance, quick glance. Once you're done with that, if you want, you can have a quick glance over the instrumentation. Is it clear? Is it clear? Okay. Then comes oral surgery overall smart notes. Okay, so this is 166 pages of notes of oral surgery. Okay, I'll tell you what to be done. Okay, so all the topics of oral surgery which are important were covered in this particular smart notes. It's not mandatory that you have to do this notes, but if you feel you're weak in understanding the concepts, you're weak in understanding finishing the things, then you have to think over of this particular notes. Is it clear, the smart notes content? So all the chapters of smart notes are covered in this, apart from the instrument diagrams as well as the drug interactions. Okay, now coming to the reference books. Okay, books that you have to refer. Okay, one is, you can keep Neelima Malik as a book of reference. Okay, I don't know whether you have the hard copy of Neelima Malik. I don't know what book you have done during your UG level, but this is a book that you can refer if you have any doubts, because our content is very huge that you don't need to go back and refer a particular book, but this is a book that you have to refer. And a common book for reference for most of the general surgery as well as the oral surgery content, because cleft lip and cleft palate you have to do from B&L. So B&L you can keep as a reference book, and followed by, I told you, local anesthesia, it is Malmed, medical emergencies, Malmed. Okay, so these are the books that you have to refer, but reference is not very specific or not required for MDS Conquer students, because everything is well refined and well referred from standard textbooks, and it is provided to you. So no need to break your heads to go back to these books very frequently. Very rarely, if you want to be strong in a particular zone, or if you feel that there is some confusion in a particular zone, then you can think of about these particular books to go back and refer. Is it clear? Not required. Basically, not required for students of MDS Conquer. Not required. Because we tried our best to cover every content from a standard textbook. Not required. But you can keep them as a reference books. So many of the students were asking, what is reference book? Okay, reference book is something you go back at a particular pace, read that pace, underline the important points in that pace, convert that to a notes, add that to your notes, convert that and add that to your notes, because you cannot go back to these reference books again and again during the revision time. Searching the same page, going back, reading, it's not going to be possible. So you have to prepare a notes if you're reading some particular content. For example, now drug interactions you have to do from this book, which I have provided as a notes for you. So this you have to do from the textbook. And similarly, there are few things called as facial neuropathies. Facial neuropathies, your trigeminal neuralgia, your facial nerve paralysis, and everything you have to do from Neelima Malik. So that part you have to write a proper notes and come back. And similarly, I am going to tell you a few topics which you have to do from the textbook. If you feel like these topics has also to be done, that is your wish. That is completely your wish, because preparation cannot be at all the levels controlled by the mentor. Mentor is going to guide you in the preparation. But at some areas, to overtake your competitors, you have to modify your preparation, but always under the supervision of mentor, direct or indirect supervision. Is it clear? Clear about the reference books? Yes. Next important aspect that we need to think over is MCQs. So once you read the base core, okay, then you need to solve MCQs. Please don't write on my screen. Okay, please. Okay. So once you're done with the core concepts, what I strongly believe is, for example, if you are planning to construct a building of 25 floors, a 25 floors building. So what is most important aspect to construct a 25 floors building is, come on guys, answer me. What is the most important thing for a 25 floors building? Bricks. Yes, strong basement, strong foundation. Okay. So you have a hidden foundation. No one will see the foundation of a 25 floor building. Okay. So you should have a strong pillar, strong foundation should be there, so 25 floors according to me is MCQs. This is going to give you pride. But how an MCQ can be so strong, how you can be more accurate is if you have a strong base. That is your core concepts. So core concepts, what are the important things in the core concepts is your knowledge in dentistry, whatever hard work you have done in dentistry. Second one is your smart videos here. Third one is your smart notes and how you organize everything. Once you start foundation will be done as Priya said, by foundation done by bricks. You'll have bricks, you have cement, you have many ingredients, all these ingredients. So, but all these ingredients together to form foundation. That is called as core concepts. Once you have a strong core concepts, you can build n number of MCQs. M number of floors. Is it clear with this? So don't miss this logic. Everything in the life has a logic. Everything around you moves with the logics, moves with the common sense. Once you hit the common sense, you're going to master in that area. That can be dentistry, that can be life, or that can be anything. But most of us, what we do is we ignore the basic common sense. We ignore the basic logics. And what happens is, if you don't have a proper foundation, what happens? Building so many floors, okay, the building will collapse. The building will collapse. Everything will get spoiled. Is it clear? Is it clear? Can I move to the next part? Okay. Now coming to the MCQ source, you can keep Dental Pulse as a first source of MCQs. It's not mandatory that you are done with the smart notes, that you are done with the smart videos, that you have to hit 100 MCQs of Dental Pulse with 100 right answers. No, it's always a process of learning. Then you can keep the second book. People who are able to finish the second book, that's the first book of choice. People who are able to finish the second book, for example, you are a repeater sitting at home and reading for 24/7, you have to keep second book, because this is the second book which is going to give a tough competition to your junior who is an intern. So this is the second book of choice. And once you're done with entire syllabus, if you want to do more MCQs, you can start solving the dental decks. I'll be providing them. Don't worry. Don't break your heads. Okay. So dental decks, You will have a decent number of 100 or 150 questions, not more than that, related to oral surgery. You have time, you can solve them. Of course, I want you to add PP books also. It's not mandatory for PP books because I regularly include PP books in the round 2. But if you are a repeater, interns will not have time. If you are a repeater, I want you to solve the oral surgery part of the PP books also. Apart from that, the biggest source of MCQs is your website. So in website, you have topic specific, you have subject specific, everything. Okay, so this time I'm going to provide you huge number of MCQs because your pride in oral surgery can be proven by the number of floors. The number of floors, I'm talking about this. And with a strong core concepts, the foundation. Okay, right? So clear with the source of MCQs that you have to do from. And first I want you to start with the dental pulse source as well as the website source. But once you're able to finish the things fast, because we have so much time for your examination, so I want you to add the second book. It's better for clinical subjects. You have to do minimum 2 or 3 books. 2 to 3 books. Keep one book as a primary thing. The others are accessory things. Clear? Clear? Can I move to the next part? Clear with the MCQs? Source of MCQs? Okay, right. So now, before closing the session, I want to give the sequence. Okay, so for the sequence of checklist, first of all of you now go back and open the smart notes. The smart notes of oral surgery. You have 166 pages notes is there, right? So in this 166 pages notes, you take your notes, or you take, I mean, better take your running notes. Okay, so first open your running notes and write the topics covered in the notes. Is it clear? First go write the topics covered in the notes. Notes is already there. Don't rewrite the notes again and again. That is foolishness. First write down the topics. How many topics are there? What are the topics are covered in this 166 pages of notes? You prepare a list. So first thing you have to do after this session is prepare the list of topics covered in the smart notes of 166 pages of smart notes. Clear? First thing is clear. First sequence is clear. First sequence is clear, right? Okay. Now, according to the schedule, every day go with a combination of smart notes plus your smart video. Combination of smart notes plus your smart video. Preferably, to make your concepts more strong, smart video is more useful than smart notes. So my suggestion is every day you can start your day with the smart video. Smart video has to be given the first importance. Then you can jump into the smart notes. This 166 pages. If this topic is available, do it in the smart notes. Along with the pulse synopsis. You have synopsis in dental pulse also. Not for all the topics, very few topics. Dental pulse, after completing entire oral surgery, you have few pages of synopsis. Whenever you have a synopsis around the dental pulse for the topic you are going to read on that day, do it. Means, so along with the list of topics of this 166 pages smart notes, you have to do the list of topics covered in dental pulse synopsis. So every day you open the topic, you see whether this is covered in the smart notes or this is covered in the dental pulse synopsis. If it is covered, you have to do that. If it is not covered, leave it. Is it clear? This is more important. You'll get so much confused because things around you are not organized. Pulse is not organized. Open secret, pulse is not organized. It cannot be organized. It's a huge thing. So cannot be organized. So what a student has to do is student has to organize the things. So what you have to do, the first step, open your smart notes in your website, write all the topics, list of topics, prepare the list of topics. Then jumping into the dental pulse synopsis, write out the list of topics that is being covered in the synopsis. Is it clear? The first step, the first thing that you have to do immediately after this video. First step immediately you have to do after the video. You can check it in the recorded version here. It's already late. I don't want to drag this session for a longer time. Is it clear? I want response from all 180 students. Please try to be active. First, prepare the list of contents in the smart videos, smart notes, the list of contents in the dental pulse synopsis. Then accordingly, I want you to cover first smart video of every topic. Second one, smart notes associated with that, right? This is the first level by which your core concepts will be good. Then what you have to do, then you have to solve MCQs. So MCQs, I told you I have given different source. First solve MCQ. For example, you're doing dental pulse. Most of the students, what they do is they read question, they read answer. No, that's not the purpose. Solving is different, reading is different. So take a white sheet, take a white sheet. For example, you consider this as a white sheet. So what I'm going to do is, I'm going to keep 1, 2, 3, 4, 5, 6. For example, 50 questions are there in a particular topic. I'm going to keep numbers and I'm going to solve the questions first of all. A, B, C, D. Now I'm going to correct. I'm going to see how many marks. For example, I got 20 marks out of 50. Then what I do is, then I read the MCQs. Then I read the question. What answer I kept, I'll see. What is the right answer, I'll see. Then I'll go back to the explanation. I'll read the explanation. Is it clear? Solving MCQ is a different thing. Reading an MCQ is a different thing. First, you have to solve, understand, and answer. Then you have to move to the reading version. Yes, right. Next one, again, you prepare the same sheet, 50 pages, 50 MCQs. Keep number 1, 2, 3, 4. Now again, answer the questions. You can do this on the same day, or you can do this after 2 or 3 days. It's better you do after 2 or 3 days. Exodoncia you do today, after 3 days, again you resolve the question. Now out of 50, you will get 45 plus. Can you try this? Is it possible to get 45 plus once you're doing the same content for second time after 4 or 5 days? Is it possible to hit 45 plus? Yes, it's possible. Right, it's possible. So once you're done with MCQs, evening come back and attend the discussion. In discussion, the mentor is going to discuss 40 to 50 minutes or 30 to 40 minutes of time. An activity will run on the group that includes the group discussion, that includes the motivation for you, that includes the textbook reading for you, and everything will be covered along with some MCQs. And whatever you learn something new, which is not being covered in your smart videos, which is not being covered in your smart notes, which is not being covered in your dental pulse, add only that content to the notes. Don't write everything that is being discussed in the activity. That's going to be a huge content. So what you have to do is, which is new, which is unknown, add that. And people who are very new to this, probably going to start the preparation from tomorrow. It's going to take 5 days for you to get adapted to this system. Is it clear? What to be added to the notes in the activity is what is new, what is unknown only has to be added. It's already known, it's already covered in the smart notes. Just answer the question, leave it and move on. And use content of diagram based questions will be transferred from your activity. So diagram based questions, textbook picks, what you have to do is, it's going to be difficult for you to write, right? So what my suggestion, I was talking to, I was interacting, I had an interaction of two hours with the Bhopal students recently. So what my suggestion is, you can copy all these things to a Word document and you can take that as a printout and you can file it. Don't write. For example, I'm posting a textbook pic on my evening activity. Okay, don't write it. It's waste of time. I want you to take it as a printout and I want you to save it. Clear? Clear, guys? Can you try this? It's going to be easy, but you have to try it. It's going to be easy, but the thing is you have to try it.